Hi there, Mr. Smith. How are you today?
Good, how are you?
Doing great. So, what brings you in?
Just decided to get a checkup.
Just a checkup, okay. So, you're feeling relatively healthy?
Yep.
All right, great. When was your last physical exam?
Oh, it's been a while.
Been a while, huh? Could you
Yeah.
estimate maybe when the last one was?
A couple years, maybe.
Okay. All right. Well, I just got to confirm some demographic information with you here. Can I get your full name?
Yep, it'd be Matthew Smith.
Okay. And your date of birth?
Be 9/27/90.
And can I get a good home address for you?
Sure, it'd be 500 West 50th Street,
Okay.
Mission, Kansas. It's 66202.
Great. I hope you don't mind me just taking down some notes. I'm just going to need
Sure.
it for my memory. Okay. All right. So just wanting a little checkup here, establishing care here with us.
Mhm.
So you're not currently experiencing any illness, any problems that you can think of?
Nope.
All right. Well, we'll get right into it then. I'm just going to ask you some questions about your past medical history, your family history, and things like that, okay?
Okay.
Feel free to answer yes or no to these questions or elaborate as much or as little as you would like.
Okay.
All right, Mr. Smith. Have you had any childhood illnesses like pertussis?
Nope.
Tuberculosis, anything like that?
Nope.
All right. Do you currently have any chronic illnesses like asthma or diabetes?
No.
Alrighty. Are you up to date on your immunizations?
Yes.
All right. You got a flu vaccine this year?
No.
Okay. That's fine. It's still really early. They're available. You can get them at Walgreens. I think most insurance plans cover them, or Walmart even has them. We recommend people to get those done here in the fall time.
Okay.
Okay. Have you had any past surgeries or anything?
No.
All right. Have you been hospitalized in the past?
No.
Or had any serious injuries?
No.
All right. And we went over when your last exam was. Are you currently taking any medications?
No.
Or any over-the-counter medications like Tylenol, ibuprofen?
Just if I have like a headache or anything.
Okay. When was the last time you had a headache?
Shoot, maybe a couple months ago.
Okay, so just as needed,
Yes.
some Tylenol or...
Mhm.
Okay. Are you taking any supplements or vitamins?
No.
All right. Do you have any allergies to drugs
No.
or to food?
Nope.
Or any seasonal allergies?
No.
Okay. At your job, are you exposed to any chemical toxins?
No.
Or like an excessive amount of sun or anything like that?
No.
All right. So moving on to your family history, just let me know if anyone in your family, your parents, siblings, grandparents, if they've had any of these diseases, okay? Coronary heart disease?
No.
High blood pressure?
No.
Okay. Stroke?
No.
Diabetes?
No.
Obesity?
No.
Cancer?
No.
Kidney disease?
No.
Liver disease?
No.
Drug or alcohol abuse?
No.
Or mental illness?
No.
Or suicide?
No.
Okay. Are all of your parents still living?
Mhm.
Are your grandparents on both sides still living?
Mhm.
Okay. And do you have any siblings?
Yep. I have two brothers and a sister.
All right. Are they older or younger?
One older and then a younger sister and a younger brother.
All right. Cool.
Yep.
Are they your biological siblings?
Yep.
Okay. So we went over your date of birth and everything. Where was your place of birth?
Be Des Moines, Iowa.
Okay. And your ethnicity?
Be Caucasian. White.
All right. And what is your highest level of education?
Bachelor's degree.
Bachelor's? What'd you get your degree in?
Political science and criminal justice.
Cool.
Mhm.
What made you interested in that?
Not 100% sure.
Just at the time sounded fun or
Yep.
interesting?
Yep.
Cool. Are you currently in school?
Nope.
No? All right. And do you use your degree for your job?
No.
What do you currently do for work? Are you employed?
Yeah, inside sales.
Okay, cool.
Mhm.
You liking it?
Yeah, it's not bad.
What kind of stuff do you do at your job?
Just kind of call various companies and sell them the typical things they need: office equipment, supplies, That's pretty much it.
Cool.
Yeah.
So you're not too stressed out at that job, or?
Can be.
Yeah.
Yeah.
What stresses you about that job?
You just gotta meet sales quota. And if you don't, it just kind of stinks.
I can see that would be stressful.
Mhm.
So what kinds of things do you do to manage your stress?
Just work out, hang out with friends, and just relax.
That's good.
Mhm.
So how often do you exercise or work out, like you said?
Probably 4 to 5 times a week.
Okay. And what kind of exercises do you do?
Mainly weightlifting.
All right. Any injuries from that, or?
No, not
Good.
yet, anyways.
Good. Good social system then. Lots of friends around.
Mhm.
All right. All right. Are you married or in a serious relationship?
Nope.
Okay. Do you currently use alcohol?
No.
Never. Or smoke cigarettes?
No.
Use any sort of tobacco products like chewing tobacco?
No.
Have you in the past?
Tried it once, but it just wasn't for me.
Okay, that's good.
Mhm.
Any drugs like cocaine or amphetamines?
No.
All right. And can you tell me what you ate yesterday, like a 24-hour diet recall?
Let's see. I had a turkey wrap for dinner, and for breakfast, I had a bowl of oatmeal and a few eggs. That's about it.
That's all you ate?
Yeah.
No lunch or anything?
Kind of skipped lunch.
Were you busy or?
Yeah.
Yeah, I know, and it sounds like you're getting good nutrition from what you're eating.
Mhm.
We usually encourage 3 meals a day or snacks in between. You haven't noticed any like getting jittery or anything like that?
No.
Okay. And are you getting a good amount of sleep?
Try to get like right around 8. Sometimes I'll get 7.
Okay. Any trouble falling asleep or staying asleep?
No.
And any financial concerns?
Just student loans.
Yeah,
Mhm.
I hear you. And so for fun, what kinds of things? You mentioned hanging out with your friends and going to the gym, but do you do anything else for fun?
Occasional Chiefs game, Royals game, kind of things like that.
That's fun.
Mhm.
I know we've got that coming up soon.
Mm-hmm.
Are you experiencing any domestic violence?
No.
Okay, you feel safe at home?
Yep.
Good. And what are your current goals?
Just kind of meet sales quota, every month, and then eventually maybe get a promotion to get out of it and just manage instead, so I don't have to worry about the stress of meeting sales goal, but everyone meeting sales goal, just add to it.
Yeah. Well, that sounds good, and you feel like you're on a good track for that?
Oh, yeah.
Okay, good. So I usually ask all of my patients these questions coming up. They're a little bit of sensitive questions about sexuality and STDs and things like that. So are you comfortable with me talking to you about that?
Sure.
Okay. Are you concerned about sexually transmitted infection?
Not at the moment.
Okay. Are you sexually active?
Yes.
Okay. Are you using any type of contraception?
Yes. Condoms.
Condoms. Okay, good. And are you satisfied with your sexual experience?
Mhm.
Great. All right. So at home, do you live by yourself or do you live with roommates or?
Live with a few roommates.
Okay. And things are going well there with your roommates?
Yep.
Good. Okay. And are you having any difficulty performing your activities of daily living, like preparing food?
No.
Okay. It's a question I just have to ask
Okay.
just on this initial assessment, okay? And how do you view your health?
I'd say I'm overall healthy.
And what are your overall, your health goals? Do you want to get more in shape? Or are you trying to lose weight or anything like that?
Yeah, I'd like to keep fighting obesity.
Good. Well, I can tell from just looking at you, you seem to be in a good BMI. So, all right. So now I'm just going to go over a brief review of systems. We're going to cover all your different body systems, and I'll just ask you a few questions for each one, and you can let me know if you're experiencing any of that. Okay.
Yeah.
Okay. Have you had any fever, chills, or night sweats?
No.
Or any recent weight loss or weight gain?
No.
Okay. And have you noticed a change in the color or texture of your hair, skin, or nails?
No. I think they've stayed the same.
Okay. Any hair loss?
No.
All right. And are you having any pain in your neck?
No.
Any swelling or lumps or anything in your neck?
Nope.
Okay. And are you experiencing any trouble swallowing?
Nope.
Any toothaches?
Nope.
Okay. Are you having any bleeding gums or anything like that?
No.
Any sores in your mouth?
Nope.
Okay. And are you having any discharge from your nose?
Nope.
Change in smell?
Nope.
Or trouble breathing through your nose?
Nope.
Right. And have you had a change in hearing?
No.
Any ringing in your ears?
Nope.
Or earaches?
Nope.
No dizziness or anything like that?
Nope.
Great. Have you had a change in your vision?
Nope.
Any watery or discharge from your eyes?
Nope.
Double vision?
Nope.
And do you currently wear glasses or contact lenses?
Nope.
And let's see here. Any history of lung disease?
No.
Have you had a cough recently?
No.
And any difficulty breathing whatsoever?
Nope.
All right. And moving on here to your cardiovascular, are you having any chest pain?
No.
Any rapid heartbeat or palpitations?
I mean, other than accelerated heart from working out, no.
Okay. And have you experienced any shortness of air?
No.
All right. Have you had any coldness or numbness in your hands or feet?
Nope.
Any tingling?
Nope.
Any swelling in your legs?
No.
Or have you noticed a change in color in your hands or feet?
No.
All right. Have you had any pain in your joints?
No.
Any limited movement when you try to move around?
Pretty full motion.
Okay. Or any muscle weakness?
Nope.
All right. Have you had a change in your appetite?
No.
Abdominal pain or heartburn?
Nope.
Alrighty. And when you go to the bathroom, when you urinate, have you noticed any changes in how often you urinate?
No.
Or any pain during urination?
Nope.
Or notice any change in the color of your urine?
No.
Okay. And any pain in your penis or your testes?
Nope.
Okay. Any lesions or discharge in that area?
Nope.
All right. And have you noticed any intolerance to heat or cold?
No.
All right. Any excessive sweating
No.
or nervousness and tremors, like shaking?
No. No.
All right. And have you noticed any like excessive bleeding, like your gums are bleeding, your lips are bleeding?
Nope.
Or a lot of bruising on your
No.
body? Okay. And do you have any swollen lymph nodes that you can readily identify?
No.
Or had any allergic responses recently?
Nope.
All right. Have you experienced seizures or loss of consciousness?
No.
Okay. Any confusion or change in your level of consciousness?
Nope.
Any headaches outside of just occasionally?
Nope.
Okay. And have you experienced any changes in your psychological well-being, like any depression or loss of interest in things that you're normally
Nope.
excited about? Okay. Any rash anywhere?
No.
Or sneezing, excessive sneezing?
Mm-mm.
All right. Well, that concludes our health history, and I'll proceed to our physical examination. Thank you, Mr. Smith.
Thank you.